Setting: hospital ward. A 45-year-old patient was admitted in the hospital ward following an anaphylactic reaction to chemotherapy drugs. You are here to do the clinical observation and check his progress. Now let's see the task. First one says, explain your reason for the visit. Clinical observations, temperature, blood pressure. Second one says, check how the patient is feeling now. Third one says, explain possible causes of headache, dehydration, exhaustion, after effects of allergic reaction. Offer to provide pain relief medication and fluid, cup of coffee or tea. Resist giving the time scale for hospitalization. Depends on doctor's decision. Requires close monitoring to ensure the patient is stabilized, breathing, oxygen saturation, BP and temperature. Sixth one says, reassure patient about dealing with allergic reaction. Alternative chemotherapy drugs, immunotherapy, slower delivery of treatment, doctors to provide more information. 7.1 says, offer to contact the patient family, inform the family about the patient's situation, arrange their visit with overnight bag. Last one says, offer to check with doctor about food, establish patient's consent to do clinical observation. Now let's begin the role play. Hello, good morning. My name is David and I'm one of the registered nurses in this hospital ward. I'll be your attending nurse today. May I know your name and age for verification?
Good morning, nurse. I'm Alex and I'm 45 years old.
Thank you, Mr. Alex. I understand that you've been admitted here after an anaphylactic reaction to chemotherapy drugs. Am I right?
Yes, nurse, that's right. So I'm really worried about my health condition.
I understand that, how hard this is for you, but try not to be worried. We are here to help you and you are now safe hands. Okay, Mr. Alex, I'm here to do the clinical observation for you. That is, I need to take the temperature and blood pressure. So before beginning it, may I know how are you feeling now?
I was really exhausted when I got this reaction. Moreover, I was not able to breathe properly. Now I'm okay. However, I have slight headache. Nurse, please let me know why it's happening.
I completely understand the situation, Mr. Alex. Let me explain you the reason behind the headache. First of all, it may happen because of dehydration or exhaustion, or it can happen because of the after effects of an allergic reaction. But please ventilate your feelings. I can provide you some pain relief medications. Along with that, you'll be provided with a cup of coffee or tea so that you will certainly get a better relief from the pain. How does that sound, Mr. Alex?
Thank you, nurse. That would be great help for me. But can you please let me know how long should I be here in the hospital to get a discharge?
Your worries are completely understandable, Mr. Alex. Unfortunately, I'm not the authorized person to confirm the time scale of your hospitalization. I would like to inform you that we need to monitor your vitals and other parameters in order to ensure that you are stabilized. That is, your breathing pattern and the oxygen saturation level needs to be closely monitored. So you need to be here in the hospital for a few more days. But it is completely dependent on doctor's decision. I hope you are following me, Mr. Alex.
Okay, nurse, I understand that. But I'm really worried about the treatment. As you know that I have been taking chemotherapy treatment for the last few months. But I got this reaction now. Will this reaction affect my future chemotherapy treatment? I really don't know what to do.
I can sense your anxiety, Mr. Alex. Please don't be overly concerned. We have several ways to manage this condition by some other possible alternative methods. That is, we may use alternative chemotherapy drugs or immunotherapy, which is a form of treatment that uses the power of the body's own immune system. Then we may slower the delivery of your treatment. Please be optimistic. This can be completely manageable and we are here to support you. Moreover, the detailed information regarding the treatment will be provided by the doctor so that you'll get a better idea. I hope you're with me, Mr. Alex.
Thank you, nurse. But I have a small concern. That is, my family is not aware about my current situation. I think they might be expecting me back home now. And they'll be worried if I do not reach home on time.
Please relax, Mr. Alex. Your family will be contacted immediately and we will make necessary arrangement for their visit along with overnight bag. Is it fine with you?
Thank you, nurse. That will be a great help for me.
Do you have any more questions for me?
Yes, Ness, I'm really hungry now. As you know that, I have not eaten anything for the last few hours.
Do not worry, Mr. Alex. I will make necessary arrangement for food after discussing it with your doctor. Is it okay with you?
Thank you, Ness, for your help.
It's okay, Mr. Alex. As I told you initially, I'm here to do the clinical observation for you. So can I have your permission to begin the scene?
Sure, Ness. Please go ahead.
Okay, Mr. Alex. So far, we have been discussing about your current condition after the anaphylactic reaction to chemotherapy drugs and its further management. I hope you're clear with that. As I mentioned to you just now, I'm going to take your vitals. In between, if you have any more questions or concerns, you can ask me. I will be happy to help you. So thank you, Mr. Alex, for your valuable time. I wish you a speedy recovery. Thank you, guys. Our role play ends here.